And of course, I realize that many of you are listening to and or watching this episode, and you're not necessarily depressed or thinking about psychedelics like psilocybin in the context of depression. I hope today's discussion allowed you to better understand how psychedelics, and psilocybin in particular, because that's what we've been talking about, are able to exert these incredible effects that they seem to exert. This is not a call for everyone to run out and do psilocybin. It is absolutely not that. It is, however, my attempt to really put a magnifying lens on this incredible area of research that's happening, not just in the context of clinical trials, but in the context of trying to understand how serotonin and how drugs like psilocybin, which in many ways mimic serotonin, and more particularly the activation of particular receptors in the brain, like the serotonin 2A receptor. I mean, just sit back and think about that. The selective activation of this receptor, which is, by the way, associated with the expansion of the neocortex across evolution. Didn't mention that before, but indeed it is. How that can lead to enhanced ways of thinking, changed ways of thinking, actual learning inside of this short 4-hour or 6-hour session that we call the psilocybin journey. So as is often the case, perhaps as is always the case here on the Huberman Lab podcast, we did a deep dive into a topic. Today, into the topic of psilocybin, what it is, how it works, the different ways in which it changes brain circuitry, how it creates the experiences that we think of as the psilocybin journey, what the safety issues are, what the so-called set and setting are that can lend themselves to positive therapeutic outcomes. And in doing so, my goal was really to highlight several things. First of all, I am very excited about the potential for psychedelics such as psilocybin to provide relief for mental health issues that to date have been very hard for people to access. In addition to that, I'm just fundamentally interested in the brain and how it works and how it can change, this thing we call neuroplasticity. To me, neuroplasticity is the holy grail of the human nervous system. As far as we know, we are the animal that can have long-lasting neuroplasticity throughout the lifespan. And if it requires the use of compounds in a safe and controlled way, such as psilocybin, in order to achieve maximal plasticity in a short amount of time, that's exciting. But of course, that also needs to be considered with all of the safety precautions in mind that we talked about earlier, including the fact that people who have a predisposition or who have psychosis or bipolar disorder, or a relative that has psychosis or bipolar disorder, younger people, meaning people 25 years of age and younger, and really anyone who's not working with a dedicated and highly trained physician needs to be very cautious about these compounds as well. They're very exciting. I think psilocybin is an exciting and super interesting compound for basic and clinical reasons and for other reasons as well. But they are sharp blades, as we say. And with sharp blades, you can do incredible things, but you can also cut yourself very badly. So all those considerations need to be taken to mind. So I consider the science and use of psilocybin to be an exciting but still preliminary area that I certainly am paying a lot of attention to, and I know there's a lot of excitement about. So stay tuned for the episode with Dr. Robin Cartart-Harris, and we will probably revisit psilocybin, and we will certainly revisit the other psychedelics and non-classical psychedelics, including LSD, DMT, 5-MeO-DMT, ketamine, MDMA, mescaline, and all the rest in future episodes as well.